effects of the electromagnetic radiation. Now, 7.5 years ago, when I first did my research, I found this amazing research that they did, and she actually posted it in PubMed as well. All right. Now, Dr. McDowell is trying to show us that when we are living in a healthy, clean electromagnetic radiation environment, your red blood cell should look like this, which is over here. Look at my arrow, my cursor. Okay, at the bottom. So your red blood cell should be flowing freely like this, individually, bringing oxygens to the cells. At the same time, bring out the carbon dioxide, through the exhaling of your lungs. But according to her findings, when we are using 70 minutes of computer, all right, desktops or laptops, your blood actually goes into this condition. And according to a scientific term, this is called the rouleau formation. All right, means your red blood cell begins to stack together. We call it sticky blood. There is a lot of different layman terms. Okay, now, and what is more shocking is that after using the cordless mobile phone, her own rouleau formation went into a critical condition. Can you look at the top right? All right, top right sample. So this is actually her blood sample. And just 10 minutes of mobile phone use, the rouleau formation actually went to this condition. And some of you here, you're typing 3 hours, 5 hours, 6 hours, 12 hours a day. Can you imagine that? Okay. Now, if you watch a video, Dr. McDowell even mentioned that now this critical rouleau formation is what she normally sees in all her cancer patients' blood and also all her diabetic patients' blood. Now, in other words, people with cancer or people with diabetes will only have this condition. But this new finding is telling us that by just using your mobile phone for 10 minutes, you're seeing the same condition. So this is alarming, right? So now, when you have this condition, of course, these are the symptoms and consequences, all right? It promotes poor circulation, it promotes low oxygen transports, and more headache, fatigues, and stuff like that. So question yourself, some of you here holding a mobile phone. Now, while you're watching Netflix for 2 hours, any of you here, you feel that there is this numbness on your palm, you feel numb. You begin to feel numb on your palm by holding the mobile phone for just 1 to 2 hours, okay? Now, the symptoms are stated here. Numbness, all right? Tingling, cold extremities, okay? Now, what if today I share with you that by using the emGuarde technology and through the harmonization process of the emGuarde, a patented technology, we can potentially mitigate this risk, okay? So the next video I'm going to introduce to you, it's done in a medical clinic in Malaysia. And now this doctor is called Dr. Roland. And he believes so much in Dr. McDowell's research on rouleau formation. And what he did was he actually did the exact same test, on one of his client, and his name is Mark. Okay, I would like you to watch this video for 2 minutes before I continue my explanation on this.
So what we can do is you get on your phone for maybe close to about half an hour, holding it, and then we'll check again and see how does the capillary blood look like.
It looked like my first blood test result was clean, with no signs of blood clotting or blood clumps. But would just 30 minutes of cell phone usage really do any harm at all to my body? I hope not. Let's find out.
Let's have a look. So you can see all the cells now being stacked. See, all of them, we cannot see those loose cells. You can.
Okay, now I'm going to pause the video here to further explain to you. So Mark actually did hold his phone for 30 minutes, all right? And during the first break, they discovered that the red blood cells condition is exactly what they saw back in Dr. McDowell's research. And Dr. McDowell's research was 10 minutes, and this is 30 minutes, all right? So it's identical, it's similar. Okay, let's continue the video.
See, most of the cells now all stacked
Up together, right?
Exactly. Just look at that. The big message is always to try to reduce our exposure. It's almost impossible not to use, but try to be a bit more cautious in the usage.
The thing is, I know you say it's better to reduce. It's impossible for somebody like me. And I'm sure there's lots of people out there that also need to be holding their phones. So is there anything I can do?
This is the device. that can actually help harmonize your electromagnetic frequency wave. And you want to see how it works?
Sure.
Come.
With the environment harmonizer turned on beside me, Dr. Roland and I proceeded to do a third blood test to see just how well this technology supposedly suppresses EMR. Okay, so this looks completely different to the last test, doesn't it?
Yep. Clearly looks different, lesser rule of formation.
Now, are you guys seeing this? Okay, now emGuarde has been made available in the market for the past 2 years and 3 months now. All right. And we've got countless of distributors that are actually repeating this test privately at their homes, or even they bring it to some of their certified nurses to do the same test. Okay. And they're getting the same results as well. Now, I would like to do a quick explanation here. Now, some people, they can actually see this before and after in just 15 minutes. And some people, it takes them 30 minutes. And some even went further. Some needs 40, 45. Okay, so 30 minutes is just a general guideline, but some of you here, you might need a longer time to see this. Okay, probably 40 minutes, 45 minutes. All right, it depends. Just in case some of you here would like to adopt this, this test or experiment and you want to do it yourself, just give it a bit more time if you're not seeing the same results. All right, it will happen eventually. Okay.
So what we
So now, besides Dr. Roland, of course, we have accumulated some of the other doctors' documentation as well. And this particular Dr. C so happened that he was curious as well as a medical doctor. He wanted to do the same thing. And let's listen to him, you know, what sort of results he got in from one of his patients as well while doing the same test.
Thank you. I'm Dr. C, a wife of husband of Grace Mary, who is a distributor. I have been